In a world where drug abuse and preventable health problems threaten the lives of our youth and communities, one organization is standing strong, compassionate, bold, and consistent in its mission. This is DAPHO, the Drug-Free and Preventive Healthcare Organization.
Gaskiya rayuwa ta da gaskiya is bad. Amma ba ta kasu haɗuwa da DAPHO yanzu har ga Allah.
Since I met DAPHO, my life has never remained the same. It has changed. I feel healthy. I have reduced the amount of drugs I take, and I hope to stop it completely.
Fata Allah zai kawo mana sauki a wannan lamari nan.
Lokacin da na fara samun tallafi daga DAPHO shine lokacin
I started receiving assistance from DAPHO for a very long time through peers educators. Some of us thought it wasn't something serious, but we later agreed to benefit from it.
su ko wani waye suna tsangwaman su har suka zo su ma suka fahimci tasirin abun suka fara ba da haɗin kai.
It all started with a vision. What began in 2013 as the Council for Nonviolence Initiative was officially registered in 2015 as DAPHO. Since then, the organization has grown into a powerful symbol of hope and change across Nigeria.
My name is Sanedi Akpan. I'm the Executive Director of Drug Free and Preventive Health Organization, an organization which I founded in 2013. Drug Free and Preventive Healthcare Organization, as it is known today, started as a movement called Council for Nonviolence Initiative. Our idea was that as young people, that we did not want young people who were mostly did not have jobs, did not have opportunities for engagement, and who may be using drugs or vulnerable to drug use at that time, to be engaged in political hooliganism. So in 2014, we went to the Ministry of Youth and Sports in Akwa Ibom State then, and we registered the name Council for Nonviolence Initiative as an organization, as a pressure group, youth pressure group, and that is how we started. Fortunately, nothing happened much apart from us going out to drug using hotspots to talk to those people so that they don't get involved in this violence, political violence. And all of this, we're doing it in preparation for the 2015 election. We didn't want the bloodshed that we saw in the 2011 elections. In 2015, I think that was January, we were contacted by Heartland Alliance. We were told that there's a program called Expanding Key Population Intervention in Nigeria. The idea of the program was that they were looking for organizations that was led by people who use drugs, sex workers, or men who have sex with men, to develop those organizations to become formal organizations. And we were part of the organizations that presented. We went for an interview, and our organization was accepted as one of the organizations. And that is how our journey started in the HIV and harm reduction space. Thankfully, because we had a community credential for the project in the whole country, of the 13 organizations that were implementing it, we were able to mobilize the most, including even among organizations implementing in Lagos. We mobilized the most persons to access care. We were given a target of 200, but we were able to mobilize 256 at the end of the day to access care, to access drug dependence counseling at CRISA. And so that staked our credential also as a community organization. Having pioneered the formation of the Nigeria Drug User Network, which had membership across the whole country, I reached out to members of the network and started asking them which of the states is viable that we can come and get evidence of rejecting drug use. Gombe was mentioned, Kano was mentioned, 2 states in the north. I supported myself with transportation and money for accommodation and came to Gombe State. I got here to Gombe. I was stayed for 1 week. I was taken round. I was shown where people inject drugs. I took pictures of people actually injecting. I took pictures of injecting wounds, and then I went back. And when we had the next Global Fund meeting, I was able to present all of this. It was on the basis of my presentation that we had the first national dialogue on drug use. And it was on the basis of that that we had the first dialogue on the needle and syringe program, which resulted in the implementation of the needle and syringe program. So we were actually the first organization to implement the needle and syringe program because we were implementing in Gombe State. The states were selected. Gombe was actually a global fund state, Kano was a global fund state, and some other states, but Gombe State had a high prevalence looking at the KPSE of people who inject drugs, and so Gombe State was chosen in the north. But that is how we were able to come to Gombe State. We were offered Gombe State because at that time, there were not a lot of organizations that were experienced in implementing drug user interventions, or were community organizations. And also because most people were afraid of coming to the north. But, we took up that challenge to come to the north. And that is how we were able to implement in Gombe and Kano State.
Through programs like VIV, Hepatitis C, and the Global Fund entry, DAPHO is reaching the most vulnerable, offering harm reduction and reproductive health services. Each step is grounded in dignity, human rights, and compassion.
Key health issues that the project is trying to address is the hepatitis C. It's an operational research we are conducting with the support from UNITAID and Frontline Aid. We are conducting this research toward addressing hepatitis C among people that inject drugs in Gombe State, and looking at prevention and treatment. For prevention, we are looking at the provision of loaded space syringes and also providing other prevention commodities like condom, lubricants, and other prevention commodities. We are also going to look at testing and treatments as the model of care. So the project is trying to impact the vulnerable community by helping them and taking the service directly to people that inject drugs at the community, and we make it easier for them to have access, especially for those periods, people that inject drugs that are in the community and are positive for hepatitis C. We make the services easier for them, and they will be able to know their status, get treated, and live healthier lives without fear or discrimination.
Well, my project addresses mainly sexual and reproductive health, harm reduction, and human rights services for women who use drugs in Gombe State. We've been able to impact, we've been able to touch a lot of lives, especially women who use drugs, as I said initially. We've been able to build their capacity on sexual and reproductive health, human rights, and harm reduction services. We've been able to increase opportunities for them in the society. This is through our socio-economic empowerment, which in line we have a skill acquisition center, which most of them are learning 1 or 2 skills. We've been able to reduce stigma and discrimination among women who use drugs in Gombe State. And so far, we've been able to create awareness generally for women who use drugs, because most of them face a lot of stigma and discrimination. And then the only way, one of the ways out, is to see that we create awareness among them and also create awareness in the society or communities generally. So we've been able to impact the lives of women who use drugs in Gombe State in several ways. One of it is through our skill acquisition center, which is called Vocational Therapy Against Drug Dependence. We've been able to enroll some of them to learn 1 or 2 skills at the center. And still under socio-economic empowerment, most of them have been able to build up businesses for themselves so far. And then Besides that, we've been able to create awareness among women who use drugs and the general population at large, because most of them face stigma and discrimination. So with that, we have a decrease of stigma and discrimination among women who use drugs. We've been able to create or reduce health disparities among women who use drugs and increase access to healthcare services.
Currently, we have 2 projects in Akwa Ibom State. The VIV Gender Sensitive Harm Reduction Program, specifically focusing on women who use and inject drugs in Akwa Ibom State. And the second project is the Global Fund Community-Led Monitoring Intervention under the network of people living with HIV and AIDS in Nigeria.
The basic health issues that we're trying to curb here in DAPHO is the issue of harm to the community of people who use and inject drugs here in Gombe State. We have been implementing since last year under this project grant, September last year, and most of this harm comes from sharing of needles and syringes by our community members. Also, when we say harm, it doesn't stop at physical harm. It can be psychological too, where we offer psychological services to all these peers at the community. We offer IPC to them on their injection practices and how we can incorporate them back to the society through offering these harm reduction services to them.
At the heart of DAPHO's success is its people, the staff, the volunteers, the leadership. They are more than a team. They are family, driven by purpose, built on values, working together to change lives every single day.
This center helped them a lot because he give them businesses different type. It depends the one that person choose that he will do, the one that he will perfect on it, so that when he learn, he will do business on it and help himself with it.
Wa'anda suka samu gyambo ta gurin yin allura yawanci DAPHO ta.
Those with wounds, DAPHO referred them to the hospital for treatment. DAPHO also paid for surgeries of some of them, and some were amputated based on doctors' advice.
Hannu ne yasa abin ya same su amma ba zai dawo ba hannun, DAPHO ta biya kuɗi a yanke hannun saboda an samu shawari ne daga gurin likitoci, ba wai DAPHO ta ɗauki nauyi ko to a jiya yanke, a'a likitoci suka ba da shawari suka ce to wannan hannun ga abin da za a yi masa.
Gaskiya DAPHO na jima ina karɓar tallafi a hannun DAPHO.
I have been receiving support from DAPHO since 5 years back. They sensitize us about safe injection.
Game da suna ɗan faɗakar da mu game da injection da muke yi.
So what do we need as an organization to be able to have the very good team of staff for DAPHO? Now, one of the things we do, we ensure that the process is being followed. We have, from the adverts, we have shortlisted candidates, we do a background check on them. After doing a background check on them, then we invite them for interview. Most of our interviews are not just the verbal interview. There are cases we also have practical interview whereby you need to showcase your talent. And most of the times we try to prioritize the discriminated targets, that's our period and period. As part of, those are some of the criteria we see. We try to ensure that we added them up to the team of work, because we know that in other organizations, they don't have that opportunity and privilege. So those are some of the things that we look at in our recruitment. We ensure that we give a plain platform. Once if they are able to meet up the criteria of recruitment, they are being recruited. Now, skills and values that are essential for our staff and our volunteers. One of the basic one is you need to have empathy. because of the nature of our work and with the nature of our target audience. You need to have empathy, and apart from that, you need to have very good communication skill, team building skill, because at various times we have to support each other in the work and in the process. Then problem solving skill, like me personally, I don't want a situation whereby we kept getting problems, no solution. You need to have problem solving skill to be able to suggest a particular solution to a particular problem, because in the line of our work we sometimes have little challenges when it comes to implementation. What you expect, reality changes things, and very good time management is essential for us. Now, as an organization, we have our core values, which is, I will never emphasize the issue of empathy, integrity, accountability, respect, reliability, and confidentiality. These are most of our core values as an organization.
At the Vatad Center, healing goes hand in hand with empowerment, from tailoring to barbing, crafts to hairdressing skills becoming therapy.
And Preventive Healthcare Organization is the initiator of the VATAD Center. VATAD stands for Vocation as Therapy Against Drug Dependence. The idea for this center came out of the need to support people who have issues of drug use dependence, or who are vulnerable to drug use, or who are already using drugs and who want to take out time away from drugs and learn a trade, to be able to learn a trade. This center is meant to support them, provide them with an opportunity not just to learn, but after learning, for them to be able to practice what they have learned.
Yes, we do salon of both gender, male and female. We do henna, tattoo. We do nails, we do shoemaking, we do bedding.
This is our display area where we display the hairs, and some of the hairs is what the community members use to learn how to master their hair making. And we have this here for hair accessories, yes, and the nails and the attachments. And this is an example of our already made bed sheets by the community members, and this is a 6x6 and 6x7, also 6x6 and 6x7 duvet and bed sheets. This is a duvet. Yeah. This is the pillow that was produced. They produce, they make for themselves, by themselves. This is where all the sewing magic happens. The bed sheets, the duvet, and the shoe too is being produced using these other machines. The duvet and the bed sheets are being done here. But first off, the students have to use this manual machine for the first learning, then they move to these other electric machines.
Here, rehabilitation is not just about recovery, it's about restoring dignity and creating opportunity.
There is a significant reduction and disposal of substance use. And based on our data, we have recorded apparently 75% of participants who reported drug reduction. And additionally, I have heard transformative stories from participants who have been able to reunite, who have been able to rebuild relationships with their families, friends. They've been able to build trust. They've been able to have stable source of income.
There are a lot of impactful stories. One among them is seeing some of the women who use drugs using the small stipend that is given to them as transportation after sitting with them, like community dialogue or support groups meeting. Seeing them using the small token to turn it into small businesses, as that helps them to support their families.
This center helped them a lot because he give them businesses different type. It depends the one that person choose that he will do, the one that he will perfect on it, so that when he learn, he will do business on it and help himself with it. Like the one that they are doing, there are some people that are learning how to plait their head, how to wash the head, how to do this thing, rebonds. And some they are learning how to do the nails, some they are learning how to do the tattoo, and some they are learning how to do the bedding. Like their salon people, even they go home, when their neighbors will come, they will plait their heads and receive some cash and help themselves. Even the bed sheet, she started doing it. As you can see, she's there doing it. So she's able to make some money out of it.
Na koya ɗinka su bedsheet, su dube, na koya haɗa takalmi kuma. Gaskiya riba da yawa. A da dai mukan zauna.
I have learned how to make beddings, like sheets, duvet, and how to make shoes. Before, we only stay idle, but this center has helped me stop most of the things I was doing before. Whatever I make here has a benefit, and it is helping me a lot.
Bayan da za ka yi ka ɗinka abu babu fita. In ka ɗinka akwai ribanka. So yana taimaka mini sosai.
It can make your life to stand on your own without asking somebody or putting interest on somebody to help you. And even yourself, you can help yourself and you can help others close to you. Somebody like me now, I cannot go to market and buy shoe. Why? Because I'm making shoe. My money will not go to market and buy shoe. So these are the small benefits that we have.
DAPHO listens to the people, learns from them, and works with them. Together with local voices and leaders, the organization delivers health solutions that are trusted, respected, and rooted in the needs of the community.
DAPHO has reached out to many people and have changed the lives of many.
I am Iyeneme Mokon. I am one of the beneficiaries from Drug-Free and Preventive Healthcare Organization. I have been a drug user for years. It got to a point I was very sick and I was abandoned by my family. I couldn't do my business. I was smelling because of my health. DAPHO came in, took care of me, took me to the hospital, paid my hospital bill. Today I'm up again on my feet. I can do my business now. My family who abandoned me have come close to me, and now my family members. Thank you very much, DAPHO, for what you have done. May you continue with the good work. Thank you.
Before I met DAPHO, it was difficult for me to associate with people because of my wounds. People were avoiding me because of the smell. It was difficult for them to convince me to start receiving treatment, but it finally paid off because they even paid for my treatment and settled all bills when my arm was amputated, and they are still helping me.
A bani magunguna har ya kai ga hannuna ma su suka mun komai aka yanke mu suka ɗau nauyin jinya na komai har yanzu kuma suna ƙoƙari gaskiya.
Change is never a solo journey. DAPHO works hand in hand with hospitals, NGOs, traditional institutions, and government bodies.
You know, we are taking advantage of the specialist hospital today to provide services for people who use drugs that we are not able to provide, that is not being provided at the one-stop shop. And that is because we've been able to, you know, maintain good relationships with the specialist hospital. We've been able to maintain good relationships with the state government that runs the specialist hospital. We've been able to maintain good relationships with the Honorable Commissioner for Health. And that is why you see all of this is happening.
NDLEA was established in 1989 with a dual responsibility, that is drug supply reduction and drug demand reduction. And I am the head of drug demand reduction Gombe, which the responsibilities of that unit, drug demand reduction, is one, treatment and rehabilitation of drug dependent persons, drug education to schools, that is sensitizing them, public enlightenment, and community mobilization toward drug abuse. And as such, when DAPHO come to limelight, it seemed like they are doing part of my job. I welcome them because areas that maybe NDLEA, because it's a law enforcement agency that we cannot reach, people are afraid when they see NDLEA that we arrest and what have you. So part of the treatment and rehabilitation of the NDLEA, there is what we call harm reduction. Rather, when we say OST, opioid substitution therapy, it's still harm reduction. And as we are heading the issue of harm reduction, we say, okay, fine, we are going to key in. The whole agency key in into harm reduction. But initially, there are challenges. Challenges mostly is on the societal or the community issue. When you come with something like this, harm reduction, first and foremost, people, because of their tradition, religion, and culture, they are seeing that harm reduction, since it involves sharing needles and syringes, sharing condoms, they are seeing it different. And even the substitution of drugs, that is opiate to betadone and the rest, people are saying, if now you are giving all these services, it seems like you are encouraging drug use. You have gone a long way out of DAPHO because it's one of our responsibility to educate. Whenever we go out for sensitization or public enlightenment, we talk about harm reduction and disabuse the mind of the people about encouraging. We say it's not encouraging, it's only to contain the spread of HIV and viral hepatitis and to have a safer and health existence.
These partnerships are essential to delivering lasting impact and saving lives together.
We have a collaboration with the DAPHO organization, and what we have been doing with them is excellently top-notch because it really helps our work for the work they are doing in the community. They go out there, health educate and sensitize these women, and also facilitate their transportation to the clinic where we take up. We educate these women concerning cervical cancer screening, we screen them, and we also advise them on their follow-up because the screening entails every woman to be doing it continuously for after every 3 years for those that are negative. And they also help They also take up back with the women in the community to continue educating them to also come back for their screening. And for those women that we have found positive for precancerous lesion after screening, the organization also help out in supporting their treatment, where they buy the drugs for the treatment and we take up the treatment. And even for those that we normally take samples for cytologies and histology, the organization take care of payment for those lab tests. Also, they support these women with transportation to bring them to the clinic for the screening.
The road has not been easy. From funding shortages to difficult terrains, DAPHO has faced many challenges, but its resilience remains unshaken because the mission is too important to give up on.
The challenges of starting, a project from the very beginning, or starting an organization like this from the very beginning. Of course, first of all will be funding. So you don't have the funds when you're starting, and understanding the space we are in. We're in the civil society space. You need to be known to get funding. And how did we surmount that? It's about the passion. I had the passion for it. And then along with the people we're working with, we had the passion, and so we didn't mind bringing out money from our own pockets. We didn't mind, for example, like I'll tell people going to sleep in a brothel, because that's where we could find cheap hotel rooms so that we could have meetings with the Global Fund. Secondly, you are in a space where you're working for marginalized people, or people who are criminalized, let me put it that way. It's a more appropriate word to say criminalized. For people who are criminalized under the Nigerian legal system, drug use is a criminal offense, peddling is a criminal offense, possession is a criminal offense. Now, coming out as to say I am someone who has experience of drug use and I'm working with people who use drugs, first of all, the stigma, the discrimination, times when doors will be shut in your face, times where you hear snide remarks about what you do and all of that. It could be quite discouraging. It could affect your own mental health. But when the passion is right, like I said, all of that fades into oblivion, and you just keep moving ahead, with the goal in your mind. You don't mind what you're seeing.
Okay, so for the challenges we have in DAPHO, I would say is availability of fundings, and also we have short-term fundings where we have fundings that is less than a year. This really affects our interventions because it does not give us the opportunity for long-term planning of financial activities. We are limited because of these short-term fundings.
We've done training for most of our community members and our facilitators who go into the field for work. And then anytime before they go, I personally do security assessment because already I have a work plan for every month on each of the projects. So I do security assessment on particular place that we are going, and then I inform the security agencies that we are going. So we move in for work, but we also contact our gatekeepers who are in the community, and then we also have stakeholders. So I talk to them, and if there are threats, they normally tell me. The security agencies, if there are threats, they tell me. If there are no threats, they ask us to go. So we go, we do our work, and then we move. After that, I will report to them that the work or the field work is a success.
So the major challenges that clients do have, DAPHO clients, is stigma and discrimination which they face in the society. But what DAPHO do always is that they are always with them at the process of referral and process of treatment. So when they escort clients to facilities, they ensure that the clients have access services at the facilities. And another major challenge that clients do face is poor support from family members.
The most common challenges I've seen clients having are They face issues like stigmatization, discrimination. People come with co-occurring disorders like substance use disorders and depression. People have anxiety. People come with different kinds of things. So but the most common ones are stigmatization, discrimination, anxiety, depression, and substance use disorders.
DAPHO's eyes are on the future, a future where every person, regardless of background, has access to health, dignity, and support.
The major services we offer at DAPHO are sexual and reproductive health and rights services, harm reduction services. So we offer HIV testing, cervical cancer screening, antenatal care, PMTCT, and a lot of harm reduction services.
The project is impacting the vulnerable community of women who use drugs in many ways that I can mention. Most importantly, it has given these women a voice, because before now, the women who use drugs were discriminated against, they were stigmatized, but now the women have a voice. Community women are bold now, they are courageous, they can come out and speak for themselves. We've actually integrated them into the program that they can advocate for themselves. Right?
Integrating mental health care into treatment of substance use disorders is recognized as best practice.
With the help of government, donors, and everyday citizens, this dream can become a reality.
DAPHO made the project a success, whereby the key population community in Kano, they used to come out and get tested without any form of discrimination. So DAPHO actually made the key population community a safer place, whereby they come out, they get tested without any form of discrimination and stigmatization. In fact, they don't even come, they really walk down to the office to get tested, because they see the office as a space, as a safe space for them, whereby no one will judge them.
If there is any issues regarding your health, we follow up with you, our community outreaches, our community facilitators, we reach out to you, refer you to the specialist hospital to make sure that you are being treated and catered for.
Because when we build hope and heal communities, we secure the next generation. DAPHO, building hope, healing communities. One person, one community, one future at a time.
Happy anniversary to Drug-Free and Preventive Healthcare Organization, DAPHO.
Happy anniversary, DAPHO.
Happy anniversary, DAPHO.
Happy anniversary to DAPHO.
Happy anniversary, DAPHO.
Happy anniversary, DAPHO.
Happy anniversary, Drug-Free and Preventive Healthcare Organization, DAPHO.
Happy anniversary, DAPHO.
Happy anniversary, DAPHO.